Hello, wonderful students. Myself, Dr. Maddineni Srinivas, your dermatology faculty. So, in this video, we are going to look at the residence page article from IJDVL on vitiligo. Before going into the actual topic, in which we are going to discuss the vitiligo and the associated systemic disease and the systemic conditions which may mimic like vitiligo. So before that, just introduction about vitiligo. It's a autoimmune condition in which antibodies are produced against the melanocytes. So over the skin, how will the manifestations be? Bilaterally symmetrical depigmented macules and patches will be seen over the skin. But you have to remember that melanocytes are not only present in the skin, they are also present in the eyes and the CNS, central nervous system. So there will be some associated manifestations. So let us look at the ocular findings. Very important. You have to remember this whenever a patient of vitiligo comes. What we have to do? We have to refer the patient to the ophthalmology department just for a checkup, general examination. Okay, why? Because patients will not be having any loss of the visual acuity, but there can be the findings which only examination by ophthalmologists may reveal. So what are all those things? Hypopigmented spots in the iris, or there can be anterior chamber pigmentation, or there may be retinal changes, pigmented changes, uveitis, and chorioretinal degeneration may also be seen, and also chorioretinitis may be they present in the patient, so which might not be clinically evident. And cutaneous loss of the melanocytes, it is often accompanied by the depigmentation of the retinas to pigment layers. And what is the significance of this? And retina, if observed, may have alternate whitish streaks and darkened areas, giving rise to tigroid appearance. This may be a quiz MCQ which you have to answer whenever you attend any of the IDVL quizzes or any other pharma company based quizzes which you might attend. Reactive proliferation of the glial cells due to choroid destruction may cause homogeneous yellowish discoloration of the retina. So the term here is retina. Yellowish discoloration of the retina may be observed. Coming to the syndromes, see, BKH syndrome and Alezzandrini syndrome, I hope all of you might be aware of them, but you might not be knowing exactly what are the findings in them. So let us quickly see what are those findings. But before that, VKH syndrome is Vogt-Koyanagi-Harada syndrome. You might have read this in your third year. Okay, so in the VKH syndrome, please remember the disease progression is going to be very peculiar. So three letters are there. VKH syndrome, there will be three phases. First one is going to be meningoencephalic phase, in which the patients might be having the neurological symptoms in the form of headache, meningoencephalitis. So the next phase is going to be the ophthalmic phase, in which the patients might be having the uveitis, and also there will be bilateral ocular alterations can be there. So this is the important word you need to remember. The findings will be bilateral in nature in VKH syndrome. Okay, whereas in the cutaneous, you have to remember that the patients are going to present with vitiligo, poliosis, and also there can be associated other autoimmune conditions like, for example, alopecia areata. And what is a possible initiating event in the case of VKH syndrome? It is just the generalized erythema or some kind of a trauma. So that is not very important for you. We are going to discuss this VKH syndrome also in a separate video, but here we are just looking at the association of vitiligo and the VKH syndrome. So in the convalescent phase, we are going to mainly see the cutaneous findings. Okay, and this can progress to, yeah, bilateral retinal detachment also can occur. So that is the importance of identification of the other features apart from the vitiligo in the VKH syndrome. Now coming to Alezzandrini syndrome, it is very peculiar in that there will be unilateral retinal degeneration in this condition. So only one side is going to be affected, and also you have to remember that the disease progression is also very peculiar. So the patients are going to develop the facial vitiligo and poliosis and several years after the ocular insult. So the patient is going to present to ophthalmologist in the case of Alezzandrini syndrome. After few years, there can be some skin that is cutaneous changes. So what will be the eye manifestations? there will be unilateral retinal degeneration, and the patients also can have gradual loss of visual acuity in one eye. This ipsilateral thing is very important in Alezzandrini syndrome. Okay, and of course there can be ipsilateral vitiligo and poliosis. So how can I remember this one side? So remember Alezzandrini syndrome. Remember Alexander. So Alexander always wanted to be number one. He always wanted to be number one. So with the help of this, you can remember there will be unilateral involvement in the skin and also in the eyes. And this can be due to some viral or autoimmune processes. That details we will see in another video. Okay, right. So these are the images where you are able to see this is a VKH syndrome patient where you can see the vitiligo lesions present. There can be bilateral involvement. Whereas in the case of Alezzandrini syndrome, the involvement, the skin involvement and also the ophthalmological involvement is going to be only on one side. And remember where on which side there is vitiligo. On the same side, the patients are going to have certain ophthalmic manifestations. Now coming to the autoimmune associations with the vitiligo. Please remember the most important autoimmune association is the thyroid organ. This thyroid gland is going to be the most important one which you have to remember. And yes, most strong association with vitiligo is there, and you have to remember childhood non-segmental vitiligo is also having this association with the thyroiditis, and it often precedes thyroiditis, the vitiligo, by 4 to 35 years. So skin manifestation is going to be the primary presentation. After a few years, the patients may land up into the thyroiditis. The patients can also have type 1 diabetes mellitus, and there can be association of Addison's disease and other autoimmune conditions like, for example, pernicious anemia, systemic lupus erythematosus, and inflammatory bowel disease. There can also be association with autoimmune polyendocrinopathies. Okay, so what are those things? So autoimmune polyendocrine syndrome type 1, there is strong association. And what will be the classic triad in these patients? So there can be candidiasis, again important skin mucocutaneous finding, hypoparathyroidism, and adrenocortical insufficiency. So these are all the points pertaining to autoimmune associations of the vitiligo. So if in case you are liking whatever content I am presenting in this video, please do hit that like button and also subscribe to my channel, so that this video is going to get a boost and also this channel is going to get a boost, and I will also feel happy and to make the other videos pertaining to the dermatology subject. Okay, so now let us look at the two conditions, erythroderma and chemicals. So how are these associated with the vitiligo? So please remember, whenever a patient has erythroderma, which is nothing but where more than 90% of the body surface area is going to become red and also associated with scaring. This is also called as red man syndrome. So just imagine a patient of vitiligo is there. Okay, he or she is having vitiligo patch, a small patch over the body. I hope all of you know this concept of Koebnerization. So this concept of Koebnerization in dermatology, it is associated with psoriasis, lichen planus, and vitiligo. So what is this combination? So if there is a trauma, so along the lines of the trauma, there's going to be development of the morphologically similar lesions. So in the patients of vitiligo, if there is erythroderma, just imagine there is a trauma all over the body. So then what will happen? There is going to be almost total skin involvement. So after the erythroderma subsides, the patient might be having vitiligo almost all over the body. So this is one important finding which you might be asked whenever you are presenting an erythroderma case or a vitiligo case, if the examiner likes to ask about the association between these two conditions. And what are the triggers for the erythroderma? There are many. Most important one is eczema. There can be psoriatic erythroderma also. Okay, so other drug reactions and Sézary syndrome also could be the triggers. So coming to the chemically induced vitiligo, I hope all of you know this, that the phenolic compounds, and also the monobenzyl ether of hydroquinone in the case of the slippers, and para-tertiary butylphenol in the case of the bindi. So these are associated with the chemical leukoderma. Okay, so whenever there is a contact of these chemicals in a person who is not having any vitiligo lesions, okay, there are no vitiligo patches whatsoever in these individuals, but because of these chemicals basically are going to damage and destroy the melanocytes, because of which in the skin we can see the vitiligo like lesions. Okay, so specific patches may be seen wherever there is a contact, or we can also see generalized vitiligo in these individuals. And there is also one medication which you need to remember, which is infliximab, which is a monoclonal antibody. It is also associated with this chemical induced vitiligo, and due to the mechanism which is similar to lupus like syndrome. So now coming to important systemic conditions which may appear like vitiligo clinically. So what are those conditions? So let us look at one by one. Tuberous sclerosis and Waardenburg syndrome. First of all, let us see the tuberous sclerosis. So in this, the patients are going to have typical lesions which are hypomelanotic macules. I hope all of you know what is the name of them. They are called as ash leaf macules. They are called as ash leaf macules. And also these patients can also have confetti like pattern. Small dotted hypopigmented lesions can be present over the body. And also there can be segmental distribution in these patients, which we can see. So congenital development is going to be seen usually, and within first few years this is going to manifest most likely, if not present since birth, at least in first few years the lesions are going to be developed, and the lesions are going to remain stable. They are going to remain stable. And you have to also remember that these individuals may also have other manifestations, like for example adenoma sebaceum may be there. There can be a Sjagren patch, Cohen's tumors, the mental retardation can also be there, and the SEGA, subependymal giant cell astrocytomas, because of which there can be mental retardation and epilepsy. So these are all the other findings which you need to remember in tuberous sclerosis. But remember, the earliest skin change which you can see and which you have to remember is ash leaf macules. So how can you differentiate the ash leaf spots from the vitiligo lesions? So please remember, in the case of ash leaf spots, the findings which I have told you, the all the rest of the findings are going to develop in the individual. So that is one point. And also importantly, the lesion, this is the ash leaf spot which you are able to see, ash leaf macule, which is going to be visualized on the wood slump examination. So very important. If just simply remember, if a child is having seizures, always examine the child through from top to bottom with a wood slump, so that you can identify these kind of the ash leaf shaped hypopigmented spots over the body. If you can identify them, you can think of the professional diagnosis as tuberous sclerosis, and just wait and watch if the patient is having any other or developing any other features of tuberous sclerosis. Okay, now coming to Waardenburg syndrome, how is this presentation going to be? So there will be hypomelanotic macules seen in the patients, which may be ranging from amelanotic to even hyperpigmentation of the skin can also be seen. And this condition is typically going to spare hands, feet, and periorificial areas. This is also important. There will be sparing of the distal extremities and also the periorificial areas. And the lesions are going to be seen congenitally from the birth. So bilateral congenital deafness, heterochromatic iridis, broadened nasal root, and white forelock can also be seen. Even palbaldism may also be a feature of Waardenburg syndrome. So how will the patients of Waardenburg syndrome appear? So here you are able to see, this is the daughter of the Michael Jackson. So Michael Jackson also had vitiligo, and most likely she might also be having the associated Waardenburg syndrome, which is a very rare condition in which the eyes are going to have the iris specifically is going to have many colors, which is called as heterochromia iridis. But this individual who you are able to see here on the top, it's a transgender individual. She is or he is having this Waardenburg syndrome, where you are able to see certain features. You are able to see there is presence of this white forelock. White forelock you are able to see, and you are able to see that the eyes are blue in color. They are appearing as blue in color, and you are also able to see that there is wide gap between the medial canthus. So these are all the important findings seen in the Waardenburg syndrome. So if you know what is the name of this famous celebrity, please you can put the answer. What is the name of that celebrity in the comment section. So next conditions are scleroderma and vitiligo. How to differentiate both these conditions? So very simple, we can say scleroderma patients are going to have a very characteristic cutaneous finding which is called as salt and pepper skin. Salt and pepper skin. So in this, basically the patients are clinically going to present with the combination of depigmented lesions in which we are going to see small hyperpigmented macules present. Okay, so this is called as salt and pepper pigmentation. And you need to remember this is also described as confetti like pattern. Confetti like pattern or salt and pepper pattern is the most characteristic word. And you need to remember that there will be systemic signs in the scleroderma patients. I hope all of you know. It's also called as systemic sclerosis. So there will be Raynaud's phenomenon. There will be fibrosis. So skin of these patients is not going to be easily pinchable. And there can be fibrosis of the lungs, kidneys, and other systems also, which is important. And these individuals also may be having possible discoid plaques which will have central atrophic changes. And coming to the vitiligo, we are going to see the chalky white macules present over the body. And basically, there will be depigmented lesions over the body where there will be complete loss of the pigment. And you need to remember that there will be no systemic signs or symptoms associated with vitiligo, unlike scleroderma. So, except for the syndromes which are associated with vitiligo, okay, in which there can be other systemic findings. Okay, right. So now coming to melanoma associated vitiligo and common vitiligo. Please remember, so most of the features are similar in these two conditions except for the progression of the cutaneous manifestation. So that is how you can differentiate between these two conditions, melanoma associated vitiligo and the common vitiligo. So in the melanoma associated vitiligo, please remember the distribution is going to be initially at the center. So centripetal distribution of the vitiliginous lesions is going to be seen in melanoma associated vitiligo, whereas in the common vitiligo, the usual big lesions are going to begin over the distal, that is extremities, and it advances slowly towards the trunk. Okay, so we can say the centrifugal distribution is present in the vitiligo, whereas centripetal distribution is present in the melanoma associated vitiligo. So apart from that, not much of other findings which will help to differentiate between melanoma associated vitiligo and common vitiligo. So I hope this video was helpful. If it was helpful, please do hit that like button and also do subscribe to my channel so that you are going to get this kind of awesome dermatology related